Good afternoon. I hope you've had a good morning. Had a good morning? Yep? Oh, that was good. That was good. Apart from the lack of coffee. I agree. Good afternoon. So my name's Tony Girelli, Sales Director for Full Support. My two challenges are, one, not to wander too far from this thing, because I do wander around a lot for some of you in the audience that know me already, and to keep, obviously, on time, because I know lunch is just 45 minutes away, and I'm sure that you're all hungry after this morning's session. So the purpose of this workshop is to talk about the importance of RPE, respiratory protective equipment, and compliance in the protection against respiratory hazards. So in this workshop, I'm going to run through a few things. We'll take some questions if you have any. My colleague here, Brian Lavelle, some of you know Brian as well, who's our national RPE expert. So what I want to talk about in this workshop, this lunchtime, is a few things I want to touch on. Hierarchy of controls when it comes to RPE, okay? Duty of care, education and training, and touch on a little bit about what we do at Full Support. And I'm pleased to say I recognise quite a few people in the room, as do Brian, where we've done fit test training and educating across healthcare. Validation and monitoring, and you see that logo there, Vigilant Safety Solutions. And for those of you afterwards, over lunch maybe, or later this afternoon, we're on stand 15 if you want to come and talk to us a little bit more about what Vigilant is. We can give you a bit more of an in-depth into this new software. But I will give you an overview to it, obviously at the end, and what Vigilant is. So I'll talk about a little bit about hierarchy of controls when it comes to RPE, respiratory protective equipment. Of course, PPE, most people know PPE, personal protective equipment, RPE, respirator masks. And in most cases in healthcare, it's something like this that you're used to seeing, okay? And you may wear these on a regular basis. It's been particularly challenging, as I'm sure we all know, this particular winter. But there is a huge range of RPE available to us. And when it comes to hierarchy of control, RPE is a control measure that's put in place, okay, to reduce risk to us as frontline workers. Whether it's in healthcare or non-healthcare, it doesn't matter. If there's a risk there, then we may need PPE, we may need RPE. But when you look at a hierarchy of control, actually, when you talk about a control measure and a risk assessment, elimination, the top one on that graph there, is actually the most cost effective. Can you eliminate the risk? If you can't, can it be substituted? If you can't, is there any engineering controls that we could put in place? Is there any administrative controls that we could put in place to try and reduce the risk? And actually, the least effective is RPE. So you shouldn't assume that RPE, we've got a risk, there's a risk of us inhaling something, so we're going to wear a respirator mask. Whether it be something like this, a single-use type mask, or a reusable mask, a tight-fitting face piece, whether it's a full face mask or a half mask, or powered air or line-fed type of RPE. So RPE is the least effective when it comes to a hierarchy of control. But how do we improve on that as the future? Because I'm sure most of you this time of year, fit testing. Oh, fit testing. Oh, do we have to? Fit testing. We have to fit test on any tight-fitting face piece to make sure an adequate seal can be achieved. And there's lots of different ways of fit testing on RPE. There's a duty of care. As people employ staff, whether it's in healthcare or non-healthcare, there is a duty of care that says, as an employer, fit testing is a legal requirement. You have to face fit test, as I said, to make sure an adequate seal can be achieved. So we do a lot of good work when it comes to education. We do a lot of awareness. Social media, the internet these days, I am sure has raised our awareness as well. Social media, LinkedIn, Facebook, of course. I woke up this morning, I'm not on Facebook. But I'm on LinkedIn, and you wake up this morning and there's lots of discussion and people posting things about face fit testing. Fit testing is make and model specific. So for every type of face piece type fitting that you might have to wear, then you should be fit tested, as I say, to make sure there's a good fit. It says at the bottom there, if the RPE does not fit, it will not protect the wearer. How do we know that? 10 years ago, I was working and there was RPE available to me. Nobody face fit tested me. I used to wear the thing, put the thing on. Nobody showed me how to don the respirator, how to fit check the respirator. The respirator was there, you wore it if you wanted to. Why would we put ourselves at risk? So I think we probably get nowadays that RPE is needed for frontline staff. Some of you are going to be wearing it a lot more than others, but we have to face fit test. And this time of year, we probably go mad to face fit test, and there's not enough hours in the day. Train the fit tester sessions to train people to make sure that they are confident and competent at being able to face fit test. Okay? And we see a lot of great work done in those education and training sessions where we're working to understand and validate what RPE is it that we need. So that's a validation process. Okay, what RPE do we need to protect ourselves against the hazard? And in healthcare, as I said, most of the time we find that it's filtering face pieces like these type of respirator masks. People don't maybe always know that face fit testing is make and model specific, so trying to reduce the selection down makes a lot of sense because you're identifying the risk, going back to the hierarchy of control. We've worked through all of those various points and we decide that we do still need RPE, okay? But it shouldn't be number one on the list. So once we've identified that we need the RPE, we talk about being adequate and suitable. Is it right for the hazard to reduce the exposure to the level required to protect the wearer's health? Okay? And in most instances in healthcare, the major majority of respirators that we wear are what we call an FFP3 respirator, a filtering face piece. Is it suitable? Is it right for the wearer? Is it right for the task, the environment, such that they can work freely without due risk to that person? So there's no point us identifying as part of our risk assessment that we need RPE and then selecting something that's going to cause us additional hazards or get in the way of the work that we're doing. So the education and training side of things is really key. And as I say, this time of year, we probably leave it a bit too late. My view is that we should be doing the face fit testing and train the fit tester and that type of work across the summer months maybe. So we're prepared for the winter months. But we will do it. We tend to leave it a little bit to the last minute. So education and training is key. Full Support's become a leading provider of RPE to the NHS over some years now. And myself, my colleagues, there's a team of us, are what we call Fit to Fit accredited. What does that mean? The HSE, BSIF and industry stakeholders came together to create this Fit to Fit accreditation scheme. So people like myself, or Brian and my other colleagues that are out there fit testing staff or training staff and answering those questions on validating RPE, making sure that there's the right selection, how to don the mask, how to take the mask off, how to do a fit check to make sure that we get a good seal on the mask. What to do for those people that can't be face fit tested. Part of the face fit test evaluation before you take a fit test is the person medically fit? Is the person clean shaven? If they're not, we don't face fit test them on any tight fitting RPE because facial hair gets and impacts on the seal of the mask. So what do we do for those people? How do we protect those people? We've become the main provider of FFP3 respirators nationally. and as I say, we're Fit to Fit accredited as well. We offer a lot of other services. Our fit test training, Train the Fit Tester services is CPD accredited, as are some of the other education and training programs that we do. We provide one of the widest range of RPE solutions, both single-use and reusable. Okay? Also innovative in bespoke solutions to make sure that we are confident, competent and compliant with guidelines around the HSE and what COSH and Public Health England say. So we talk about things called the 7 steps to a healthier workforce. How seriously do we take RPE and respiratory health? Well, I've never met anyone yet that doesn't really take it seriously. I think we all get it, that at the end of the day, in our training courses, I think the number one point we have on our slide is, why would you not want to be protected from anything that you may inhale? And of course, in healthcare, we work, we hope, in a clean environment. So we can't see the risks that we're often presented with. If I took my healthcare hat off for a minute and went into the construction industry, then we can see often what we're dealing with. Because we can walk into a room, there can be building work going on, we can see the dust and debris and the things that we're breathing in. So the 7 steps is all about understanding your legal requirements, ensuring that your staff, as I said, are confident, competent and compliant when it comes to face fit testing. So we say it's really key to engage with the key personnel in what your RPE strategy should be. Standardisation probably in this category, and myself and Brian work across a lot of other categories as well that aren't just respiratory protective equipment, but standardisation is quite key, because if you can reduce the selection of RPE to frontline staff, then you are reducing the risk of somebody putting something on that is the wrong filtration and or they haven't been face fit tested. You can also reduce the amount of face fit testing that you need to do, because fit testing is make brand type specific. For every type of respirator that you might have access to, there is the risk of us picking up something that we haven't been face fit tested on. And therefore, we don't know if we've got an adequate seal, and therefore we are at risk of leakage and our own health and safety. One of the things I sort of believe quite strongly in is making fit testing maybe a mandatory training requirement. I know I work with some hospitals that are trying to do that. Mandatory training is often reported at exec level, at board level, but often face fit testing isn't. I heard a story just recently where somebody said to me, oh yeah, one of our execs had a phone call to say, are we face fit testing? And we said, yes, we are. And they are face fit testing, but there's still a long way to go. Standardising to a trusted supplier. It's fantastic if we face fit test. We can reduce the amount of selection to the end user. We can reduce, quite a while ago, we used to see a lot of FFP2 masks and FFP3. And there was times where there was a rule. When do you wear an FFP2? When do you wear an FFP3? Again, if you didn't know that, then you were at risk of picking up a P2 when you should have worn a P3. Okay? But some time ago, somebody somewhere made quite a sensible decision that we should standardise to P3 respirators. So again, we're reducing the risk down to the end user. Being standardised into a trusted supplier means that we've got an answer, if you like, for everyone. I made a statement recently. Somebody took it the wrong way. They thought we were saying we get 100% pass rate fit testing on our masks. You're never going to get 100%. But what you do need is to be able to protect 100% of the people that might have to wear a respirator. Some of us wear them a lot more than others, of course, because of the areas that we work in. But we need RPE for every situation. Therefore, it's key that the supplier can work at audit level. So we can audit what is the risk, what is the hazard. Maybe we find that a P3 filter is not the right filtration for the hazard that we're presented with. I think probably I'll get Brian, correct me if I'm wrong, but formalin spill kits. I was with a hospital recently who showed me these wonderful new spill kits that they've just bought. that come with respirator masks. And they said, have we got the right filtration on there? The answer was, yes, you have. But I said, you do realise that people need to be face fit tested on those, don't you? What? No, it's all right, they're reusable. Doesn't matter, they're a tight-fitting face piece, you have to be fit tested. And then I met the group who might have to deal with the spill. Two of the guys had beards, so they can't be face fit tested on it anyway. So then what do we do? So it can get a little bit complicated, but there are simple solutions out there for all of us. Organising fit tester training, without a doubt, is getting better every year. That's good news. And I think that's really because we're engaging a lot closer with one another. And the fit testing of all frontline staff. Recording the fit test result. Not the fact that Steve was fit tested on Friday, and that's it. We need to record a number of results of a fit test. But we don't live in a perfect world, of course. And all this education and training is fantastic and it's engaging. But there's a time delay between the classroom and actual fit testing itself. We don't do train the fit tester and everyone sprints out the room and starts frantically face fit testing their staff. And some of you have got big cohorts of staff in busy, complicated and complex trusts, you know, especially here in London, some huge trusts. I was working with one just before Christmas. Just one department alone uses 900 single-use masks a day. Incomplete records due to using a paper-based system. So in all this technology that we have these days, our phones and iPads and goodness knows what, we record the outcome of a fit test on a piece of paper and stick it on a spreadsheet that we often can't find. So centralised records are reliant on feedback and fit test data results. So it takes me back to that hierarchy of control slide where it talks about validation and monitoring. Health and Safety Executive, their operational circular 28228, which is online if of course you want to read it, talks about fit testing should be conducted by a competent person. To be competent, the person should have adequate knowledge and receive adequate instruction and training in the following areas. Selection of the right and suitable RPE. So going back to that adequate and suitable slide that I showed you, is it right for the wearer? Is it right for the hazard? The examination of the RPE, again, trying to reduce the selection down. It's no good just taking a mask if it's single use or it's a reusable one out of a box and popping it on. Do you know how to examine the RPE? And what to do if it's a poorly maintained face piece. Non-reusable, single use. I've had just this week in a training session a lady take one out of her pocket and go, see? I said, what? Yeah, I've been reusing it. What? Why? I was told to. Why?
Save money.
Thank you. Save money. They're non-reusable. The ability to correctly fit a face piece and to perform a fit check. So if I get a phone call from somebody and they say, I've been fit testing and it's not going so well. Why is that? I'm getting a high fail rate. I fit tested 10 people yesterday, 9 failed. Okay, I'll come and have a look. And I come along and I sit and observe, and most of the time what I see is there's a lack of, or people have forgotten, because the gap from the training in the classroom back to where we work. And we all do it. We go to training sessions, I do it, we go to training sessions, we go away, we forget something. So the ability to correctly fit the face piece and perform a fit check is absolutely key. As Fit to Fit accredited people, we are tested on that as part of our accreditation. Do we know how to perform a fit check on any tight fitting RPE? The ability to recognise a poor fitting face piece. The amount of times I see face pieces on people and they're going to do a fit check. Why? It's not fitted properly. Oh, okay. We were just going to fit test. The purpose of the fit test and the exercises. The preparation of face pieces for fit testing. The capabilities and the limitations of fit testing equipment. There's various methods of fit testing. How to perform the correct fit test with the chosen method. And being aware of and know how to prevent and correct problems, either pre-fit test or during the fit test, and the challenges that we face. And the HSE regulations and approved codes of practices relating to fit testing. So again, validating and monitoring, record keeping, fit test records should be available to all employees who wear RPE and incorporating tight-fitting face pieces. Fit test records should be retained by the employer, and these records must be kept available for inspection upon request. A central file with pieces of paper in it. And unfortunately, I think that we still see people trying to use systems to record this information, and those systems weren't designed for this. Okay? So often we find ourselves going back to an Excel spreadsheet. Employers are required to keep fit test records for at least 5 years from the date of fit testing. That's not saying you have to do it, you can do it once and then wait 5 years before you do it again. You should do it regular and often. What does that mean? If our face shape changes, we should refit test. If your RPE changes, we have to start the whole process all over again. There are a number of reasons why we might fit test again. But you certainly shouldn't just do it and say, OK, I've been fit tested on that, great, that's it, I don't have to do it anymore. You should do it regular and often. Good question. Well, it's not never again, as someone said to me yesterday. But do you want to take that?
Yeah, I think this question is brought up pretty much in every training session that we do with regarding regular and often, which is what the HSE say. And I think most trusts from experience working nationally probably work on a 2 to 3 year basis, somewhere around there. And that is kind of, I think that 2 years is a reasonable amount of time with regarding fit testing. As Tony said, there may be that you would need to refit test more frequent if somebody has lost a lot of weight, if somebody's put on a lot of weight. Let's say, for instance, somebody goes out and they're playing rugby at the weekend and they break their nose, scars or moles in the area. And all of those things, people need to be, the fit testers when they're trained, they need to be aware of those different scenarios of as and when. But normally, in normal circumstances, if people shapes or features don't change in any way, every 2 years I would advise is a good period of time. I know that some trusts go with 3 years and some are trying it annually. I think annually is going to be too often. I think annually is because we suddenly get to this time of the year and we go, oh, we better do it again, we better face fit test again. And actually, we don't really see, we don't see it done every couple of years. We see every year we all go berserk for face fit testing all over again. Why? Because turnover of staff, people move around a lot, of course. And the amount of times that we go and re-face fit test people, we start to obviously recognise people. I see people in the room that I recognise here today. And we still tend to do it every year, still, which is kind of crazy. Because we don't have to do it every single year, but regular and often. It's down to the individual, of course. If my face shape changes, I put on a lot of weight or lose a lot of weight, I'll let you decide whether I do or not. Then, of course, we should re-face fit test again. But inspection of records are key, and these are just a few of the things that we need to record. And we know, because we're working on frontline with yourselves, that this isn't always the case. And one of the things that upsets me for you is that I see a lot of face fit testing done and the face fit test records are not accurate. So we're doing a lot of fantastic work, and the enthusiasm and can-do attitude from healthcare is superb. I was in Brighton doing Train the Fit Tester. Martin's sitting over there and doing fit test training, and the enthusiasm from the critical care areas at ITU, I couldn't have asked for a more can-do attitude from the people. Very rarely do I come out of a training session and sort of have to feel like I've got to bang my head against the wall because nobody could really be bothered. So that's good news, but we need to continue that momentum and take it out of the classroom and back to the areas where we work. And I think where we're falling down at the moment is that link between the classroom and what we're doing. So fit test records should include the name of the person, of course, fit tested, the make, model and size of the face piece, whether it was an own mask or a pool mask which was used. The test exercise is performed during the test. The fit test method, qualitative or quantitative fit testing. The fit factor, values for each exercise if it's applicable to the type of fit testing that you're doing. What was the pass level that was used? The date of the test, the details of the fit tester. So that fit test has been trained, if you like, to be confident in the classroom, but of course you go back to start to do it for real and you might suddenly start to hit some barriers. So to finish off this workshop before we take any sort of questions from you, I wanted to talk a little bit about Vigilant safety solutions, because we believe that this is the link, the very much needed link between doing that great work that we're all doing. We're all in it together, and we're doing in the classroom. Vigilant safety solutions. So an overview to it is that it consists of two elements. So fit testing really is about two elements. It's about doing the face fit test, selecting the right RPE. We've done a lot of fit testing, and some organisations are big and complex. And then I get somebody phone me and I go in and work at local level in a department. I go into, say, ED to work with those. And then they pull the mask out and I go, well, hold on a minute. What's that? Where did you get that from? Because the trust has standardised its RPE to reduce the risk of people putting on the wrong RPE. And you've just shown me a mask that I don't recognise. I'm not sure how you've got it. And, oh, it's an FFP2 mask. It should be FFP3 at least. So Vigilant Safety Solutions consists of two elements: a reporting suite to track, manage and report on RPE fit testing across an organisation. So it can log all of those points that I've shown you on the previous slide. So we've identified as part of our risk assessment that we need RPE. We've done the train the fit tester sessions. People on the session are confident and competent as fit testers, but now we need to take it back to the areas of work. Can we honestly, anywhere within an organisation at the push of the button, say who's been face fit tested, answering all those questions and run a full reporting suite, dashboard style, on the individual, the department, the hospital, the trust? Probably not. I was at the 5th floor at a hospital recently and the phone went and the lady put down the phone and said, I'm glad you're here because I need to know in ED how many people have been face fit tested. Well, I've trained ED staff to be fit testers in that sense, but I don't have so we had to go down 5 flights and go through paper records, and the records were lacking. They'd identified the method of the fit test. Some hadn't even circled what mask they'd been fit tested on, who they'd been fit tested. Or all the boxes are ticked, and the last box says pass or fail, and nobody ticked it. So we don't know if they passed the fit test or they failed the fit test. It consists of a field app for conducting and recording the fit testing to ensure your staff are, as I keep saying, confident, competent and compliant. So the system is easy to implement. It's a cloud-based system. We don't need to install software onto your current systems. It's portable, it's tablet-based. It's foolproof because I can't go on to the next thing until I've done whatever it's asked me to do. It's visual, so anybody can understand it. The reporting suite is dynamic portal for giving you, at a glance, real-time reporting. So I face fit test somebody, the person passes the test, it's real-time. 5 floors up, they can have a look and they can see who's been fit tested and run different reports. So you can even run reports trust-wide by skill set if you needed to. So we're presenting a customised dashboard for proving and providing single-point access management for RPE. It's centralised, so all staff records provide in-depth performance statistics, and it generates, as I said, in real time. So then all of a sudden we're going away from paper-based systems. The fit test is a field app. As I said, it's a portable tablet. We don't need an internet connection to run it, so it doesn't really matter where we are. And as a company representative coming into hospitals, I can never get a Wi-Fi connection to anything. It never works. But as soon as the fit test is done and it's linked to your own Wi-Fi, then everybody trust-wide is getting an up-to-date real-time position of where we are. So it's a robust system for organising and managing training events. We can run our full fit test training. We can eliminate a lot of human error by ensuring users are delivering consistent and accurate training every time. So that kind of story about how do I don the mask, how do I do a fit check, we can't move on the system until we've done that. So we're trying to reduce a lot of errors and get the fit test pass rate up to where it needs to be. Allowing effective management of fit testing across often really complex organisations. Last slide, before questions and lunch, of course. So we really talk about, I mean, I've said these three words a lot about confident, competent and compliant. So with the system, as I said, we're on stand 15 if you want to come and talk to us about RPE in general later, face fit testing, any of the things that we've talked about. If you want to come and talk about Vigilant, come along and see us. Fit testing, the confident, taking place with the correct make and model of mask. So we don't get that situation where another form of RPE has got into the department and people start face fit testing on that, and then all of a sudden that's not available to you, and another piece of RPE comes in. Guess what? We've got to start all over again. So it's making sure that the right selection process and it's suitable protecting of 100% of your staff. Competent, yeah, we're delivering the training. We're accredited, as I said, fit to fit accredited in both methods of fit testing. But then the cascading and the link between the classroom and the areas in which we work could be there with the Vigilant safety system. And of course, by covering those two areas off, you are adhering to HSE, COSH, Public Health England, legal requirements, guidance, anything for minimising potential litigation, high pass rate on FFP3 Easy Mask, and the reporting suite is showing that A, you're face fit testing, you're ticking all of the boxes, and you are compliant. Because face fit testing is a legal requirement, of course, and we have to face fit test.